We'll start the session another 2 minutes time. I request Dr. Keyur and Dr. Joshi to please come forward and chair the session today. We'll begin with a presentation by Dr. S. Muralidharan. Dr. Muralidharan is a professor of microbiology at St. John's Medical College, Bengaluru. He is going to talk on quality control in microbiology. Dr. Muralidharan.
Schedule. So I have been asked to speak on quality control in microbiology and serology. And I've been already sort of given a hint I should not exceed 15 minutes. So let me try to stick to that and then see how best I can try to finish that. Now, quality assurance or quality control is a part of the overall process, total process, where the quality of the laboratory results can be guaranteed, or you can assure how your results are genuine. That means it is like giving you a recipe and then asking you to make according to that. So you are making sure that it is done in the proper or in the appropriate method, and you are getting appropriate results. That is what you are seeing here. It has been summarized as right result at the right time on the right specimen from the right patient with the result interpretation based on correct reference data and at the right price. Of course, the last one definitely, yes, is required in a country like ours. But more important is we need to pay attention to all the other components what have been put across, which is very vital and says a lot what we mean when we say there is quality of the results. Now, the quality control is a part of the total quality assurance. Under that you have all this. Now here you will find that the verification of test results, which will cover almost all the aspects, and then which will compare or keep an eye on all the procedures, and basically it deals with control of errors. Primarily concerns with the control of errors in the performance of tests. And definitely you look at that, the last line, it should be practical, achievable and affordable. Again, we are coming back to the cost factor, so please keep that in mind. Now, to do that, we require the standard operating procedure, or otherwise what is known as SOPs. Now, basically it looks at the maintenance of the quality of service to the patients and to provide the lab staff with written instructions. That is what basically SOP means. So you are given a recipe how to make. So, and how best you can adhere to that. And please note that to an acceptable standard in the laboratory. Also, it should, it will help probably avoid shortcuts being taken while performing the tests, because the technologists who are performing, because if they are left to their own, they will be doing in their own way. So it is to keep a tab on them. We have this, so it will help as a guide. Or when you are not there and when they want to do something independently, that also can be looked at. So that is where this is very, very important. Now, promote safe and good laboratory practice, and definitely yes, return standardized techniques for use in the training of laboratory personnel, because in a institution where you have lot of these newer recruits or newer technologists being trained, so you will require some kind of a guideline. So if you can adhere to this, this will definitely help or make our life easy and smooth. Now, this all of you are familiar. We have the pre-examination and the post-examination stage. So if you start looking from the first, the pre-examination stage, what you require in the case of microbiological investigation. So what exactly is the investigation that you require, whether you want a culture or you want a slide agglutination or a microscopy, latex agglutination, whatever it may be. So appropriate use of the test and the correct indication. I think that is what, when I said the right use and the right place, right indication, all those things, then this has to be definitely having a request form which will be filled by the concerned clinical person, and then a sample has to be collected and transported to the lab. Very vital, under of course conditions where the samples do not undergo any deterioration. That's very, very vital. So that we need to keep in mind. Now, if you move on to the next step, you will have definitely the SOP, which will give you the procedure for examining different specimens. It may be in case of urine or serum, anything it may be. Then staining techniques, if you are going to do a gram stain or an Albert stain, whatever, or a peripheral smear for malarial parasite. So all these things you will have to do. Definitely yes, you have to keep in mind the QC for that has to be maintained. So if you are going to use a gram stain, you have to have a gram positive, gram negative, or an Albert stain. So all those areas have to be kept in mind. Then if you are going to handle the specimen, aseptic techniques have to be followed, and then preparation and QC of culture media and preservation or preservation of stock strains. Now this becomes very essential, because in a hospital where you will have to maintain these strains, this will be definitely important, and you have to again keep the temperature requirements, because it may be at a lower temperature, higher temperature. So that needs to be kept in mind. Then inoculation of the solid as well as the liquid media. Definitely yes, we need to keep that in mind. Then interpretation of cultures after overnight incubation. Most of the time it is overnight, sometimes it may be even 48 hours if it is a slow growing organism, or sometimes like in tubercle bacilli it may be weeks. Then how you are going to identify, so whether you are going to use a microscopy or set of biochemical tests, whatever you are going to use, that has to be kept in mind. Then after the appropriate identification, how we are going to do or perform the most important part that is interesting to the clinicians. They want to know what antibiotic this pathogen is susceptible. So that is where our role lies. So we must use appropriate control. So you must have the antibiotic disc QC being performed, and also the susceptibility test according to the CLSI guideline you need to follow, which keeps changing every year. Then the others are all accessory, because you have these lot of equipments being used, like I said, refrigerated centrifuge or refrigerator, whatever it may be. Then if you are going to use an immunological technique where you are going to look for either antigen or antibody, which will definitely be very important, like Vidal or Wheel Felix, whatever it is. Then the other things are safe working practice. This goes without saying because you need to follow what is called as standard precautions. I need not have to go in depth for that. Then appropriate disposal, which is creating lot of rough sea because of the plastic. Now, last week I was told that we are not supposed to use plastic, and the government is very rigid. You are supposed to carry bags to, even if you want to buy flowers or any vegetables. So that is the current status. So we need to be careful, especially when you are dealing with all this infectious material. You need to keep that. Then cleaning of glassware, plastic material, etc., which is used for these tests. And then finally, of course, the whole process of sterilization, which needs to be kept in mind, and how you take care of that. Now, this is just to give you a list of what all the QC that can be used for most of the equipments, what is there, and what procedure you need to follow, and then what is the schedule, and then what is the reference. So that has been just as given to you as a sample. And then if you are going to use the biochemical tests which are used for identification of microorganisms, there are a lot of tests. I have just taken few commonly used tests. As you can see here, for coagulase, Staphylococcus aureus will be the positive control, which forms a clot, and then Staphylococcus epidermidis, which will be a negative example, or no clot will be formed. So these are just some of the examples that have been taken from the standard books. And then when you are using, or in-house if you are preparing media, definitely yes, that needs to go through a QC. That is there. You can see the whole list of things, the date on which it was prepared, what is the control that has been used, etc. And the batch number, everything is there. So if you want to look at all these things, you need to use appropriate culture media, performance, and then for antibiotic susceptibility. Of course, it is not to underline the fact the person or the personnel who are performing the test are vital or play the key role, and therefore their role cannot be underemphasized, very vital. Then as a part of continual improvement, the lab should participate in an external quality assessment, or EQA. So that, I think, goes without saying if you want to keep the quality of your lab under tight conditions. Now, when you, after having done all this, how are you going to report your results? Very important. So it is better that all of us agree, or at least within the hospital or within the lab, you agree that you will use a standard format in which you are going to report all your results. Then if it is going to be, like I said, in microbiology there are different turnaround times, and then some we may give you just a preliminary report, which will be followed by a confirmatory or a written report later. So verbal or preliminary report followed by a written report. Definitely yes, you need to look for any corrections and clarity. Yes, authorized signatory, very, very important. I don't have to stress. And then efficient report distribution, and most important is the report should reach the treating physician or the surgeon in appropriate or within the time that what we have declared. So that is very vital. Now if they are urgent, probably you may have to telephonically inform the reports over phone. And definitely yes, we are dealing with something like HIV, so you need to keep confidentiality very, very important. So how you maintain What you do is all left to individual laboratories. You can evolve your own system and then how it is done. Okay, so early provisional report than delayed report. Okay. Now, what are the things that you will require for performing these tests? You will require space for specimen collection, then a space for analyzing the samples, and then where you are going to store, because this is very, very important. You may want to redo the test or repeat the test, whatever it is. And also for performing the tests, you may have to store them under appropriate temperature conditions. Then all the other accessories, especially in microbiology, you will have the washing and media room, very important. And then you have to have a staff room and a library. Now, equipments, how are you going to control? Because they are going to alter your accuracy of results, because if the centrifuge which is supposed to go at a speed of 2000, instead of that if it goes at 1000 or 1500, the whole result will go for a toss. So you need to make sure that your RPMs are shown correctly. So you need to look. So for that again you have to have a QC. Then if they are calibrated, yes, definitely very important. And if a person new recruit joins, very important, you must teach or train that person how to operate, because especially biosafety cabinets and others which can be life threatening, so they need to be taught how to make use of them and appropriately. Please remember that. So to conclude, of course I have a few more slides, we'll run through that because I'm closing on to the 15 minutes slot. Microbiological investigations are important in patient care, definitely yes, especially with relation to antibiotics. Then quality control helps or gives proper reports. Then attention needs to be paid to all the stages of the process. This is what I was trying to tell you. QC in serology, it will depend on the type of the test, and you are supposed to run for each batch positive and negative control. And for qualitative tests to be run much before opening of the kit, even before you open the kit you need to run the test. Okay. Then they have to be correlated with clinical history and other parameters, because you have lot of these false positives and false negatives. So I've given you examples of that. Then also please look at that. You need to look at what is the sensitivity and specificity. Okay. And if necessary, like the common example I can give you is HIV testing. So single test, it will be very difficult. So you are supposed to do 2 or 3 more tests before you can say definitely this individual is positive or negative. Okay. So this have a high degree of sensitivity and specificity. Okay. So as you know, there are first, second, third, fourth generation. So many kits are there. So it all depends on what you want to use. Okay. Now fourth generation tests are also available, which can pick up both antigen and antibody. And you look at that, they have reduced the window period further. So what was taught to us when the kits were available or began to appear in the market, 3 months was the waiting period or the window period. Now it is been reduced, even 1.5, 6 weeks you can pick up a positivity. So that is the rapidity at which the science is advancing. So we also need to keep moving or keeping pace with that. Of course, this is related only to HIV. So it says that all of us know that a single test is not adequate, because you can have false positives, false negatives. So many conditions are there. So you need to really look at what is significant, what is important. So in the light of that, with the clinical background, how you are going to interpret the test, and then definitely yes, you need to keep using of subsequent. It may be a second test, third test, or sample. You may have to redraw one more sample from the same patient. Make sure that there are no errors, technical and clerical errors. So it can happen at different levels, so you need to keep that in mind, and that will definitely add on to the quality of your results. This is okay, it's just repeat. So I think I will stop here, 15 minutes time. Thank you, sir.
We'll allow a couple of questions.
So what is this 5:3 table in CLSI guidelines for antibiotic sensitivity
Pardon?
test?
Pardon?
5:3 table which is present in CLSI guidelines for antibiotic this monitoring of antibiotics. QC of
5:3.
Yeah. In CLSI guidelines,
Which years you are referring to?
2014.
I'll just check. I do not know. 5:3.
This
Sir, can
maintenance of stock
Okay,
stock
I'll
culture.
just check that and tell. I do not know what it means. 5:3. I'll just get back to you. Then.
What is your opinion on usage of other BLIs combinations apart from piperacillin and tazobactam? Because ceftriaxone, sulbactam, cefepime, tazobactam they will be using, but they will ask us what is the whether it is sensitive or resistant. But there is no clear-cut guidelines for ceftriaxone, sulbactam combination, zone sizes, nothing is there. Then how to interpret, how to give an answer to them?
It is very, very difficult. One. Second is, as you are now, you have seen how the drug controller has banned so many combinations. Slowly that will come to our category also, because now they are looking at all different type of combinations. So the same thing will come to us. So I think then it will slowly get sort of sidelined. It may not be required, but I would like to stress that all those combinations, if they are going to be rational, please use them. But we have to find a guideline, and then if it is justified, then yes, you can use. If the number is going to be, or if it is going to affect the patient care, if it is really significant, then you can use. There is no need, because the guidelines may not be there. You may have to look at, say, if it is not there in CLSI, you may have to go to British formulary or the British Pharmacopoeia, so like that, or European standards. So you need to use that if you want, but make sure that it is really going to matter to the patient and to the clinician. That's all I would like to say.
Any other questions? Dr. Murali, please receive your certificate and a memento from our chairperson.